What is liver duty? The liver helps digestion by producing bile, makes proteins for the body, stores iron, converts nutrients into energy, builds substances that clot blood to heal wounds. It helps to resist infections by creating immune factors, removing bacteria, toxins and substances that can damage your body, from your blood. Fatty liver. It is a common disease caused by excessive accumulation of fat in the liver. A healthy liver contains a small amount of fat. When fat reaches 5 to 10% of your liver weight, it becomes problematic. There are two main types of fatty liver disease: non-alcoholic and alcoholic. Fatty liver can also occur during pregnancy, although this is unusual. Non-alcoholic fatty liver. If you do not consume alcohol and have fatty liver, you have two conditions. Either you have a simple non-alcoholic fatty liver, or your non-alcoholic fatty liver is associated with accumulation of excess fat and inflammation. If you do not treat the second state, it can lead to liver fibrosis or, in a more severe case, cirrhosis and liver failure. Alcoholic fatty liver. High alcohol consumption damages the liver. If you don't have inflammation, you have a simple alcoholic fatty liver, but if you have excess fat in the liver and it is inflamed, you have hepatitis liver. If you don't treat alcoholic fatty liver, it leads to fibrosis and cirrhosis of the liver. Symptoms of fatty liver. Fatty liver is a silent disease but sometimes has symptoms that lead to pain, discomfort and fatigue in the liver area. Swelling of the abdomen and feet. Jaundice of the eyes and skin. Enlargement of blood vessels under the skin. Loss of appetite followed by weight loss. There nosebleeds. Skin rash. Breast enlargement in men. Fatigue and constant lethargy. Confusion and lack of concentration. Reasons for non-alcoholic fatty liver disease. People with the following diseases are more at risk of developing non-alcoholic fatty liver disease. The patient may not have any of the following diseases: obesity, type 2 diabetes, high cholesterol, high blood pressure, hypothyroidism, polycystic ovary syndrome. 4 non-alcoholic fatty liver grades. Treatment can vary for each grade. Grade 1 steatosis, simple fatty liver, a stage in which there is a harmless accumulation of fat in the liver cells, but not to the extent that its symptoms appear. Grade 2 non-alcoholic steatohepatitis, a more serious form of non-alcoholic liver fat and occurs if the liver is damaged and causes inflammation. Steatohepatitis occurs more often in people who are overweight or have diabetes. Grade 3 fibrosis occurs when persistent inflammation causes scar tissue around the liver and adjacent blood vessels, but the liver is still able to function normally. Grade 4 cirrhosis. The most severe grade is non-alcoholic fatty liver and occurs when normal liver tissues are replaced with fibrosis to the point that the structure and function of the liver are affected and can lead to liver failure and liver cancer. 3 grades of alcoholic fatty liver. Grade 1 steatosis, fatty liver, it is characterized by excessive accumulation of fat inside liver cells. People who consume heavily alcohol usually reach the stage of fatty liver in the early years of alcohol abuse. Grade 2 alcoholic hepatitis. With inflammation of the liver that leads to the destruction of liver cells, its symptoms appear. Jaundice, yellowish skin and eyes, is the most common symptom at this stage. Grade 3 cirrhosis of the liver. The last stage of alcoholic liver disease is where permanent scarring of healthy liver tissue occurs. This grade is an extreme and irreversible situation. Ways to prevent fatty liver. Lose weight, don't lose weight fast, have principled weight loss. Reduce sugar consumption. Exercise. Drink coffee. Have proper nutrition. Don't consume alcohol. Don't smoke. Don't eat greasy and fried foods. Consume fruit and vegetables. Less exposed to toxins and chemicals. Less use of chemical drugs. Stress and anxiety control. Reduce salt intake. Acute fatty liver of pregnancy. When excess fat accumulates in the liver during pregnancy, it is a rare but serious complication during pregnancy. The exact cause is unknown, although genetics are also unaffected. This type of fatty liver usually manifests itself in the third trimester of pregnancy. If the disease is not treated, serious risks to the health of the mother and baby are ambushed. Acute fatty liver of pregnancy can lead to preterm labor. Even after childbirth, you need serious care. Your liver health is likely to return to normal within a few weeks of delivery. Ways to diagnose fatty liver disease: body examination by a doctor, blood tests, liver biopsy, imaging ultrasound, CT scan, MRI. Golden tips: best natural foods for the treatment of fatty liver: ginseng, licorice, turmeric, garlic, ginger, salmon and sardines, cannabis, walnut, olive oil, sunflower seeds, lemon, apple, avocado, beet, raspberry, grape. Daily consumption of 2 tablespoons of apple cider vinegar.